Hi, my name is Semi-Occluded, CEO of the Monster Factory and vocal stunt performers for video games and movie. Working as a voice actor or vocal stunt performers in video game and movies can be quite challenging for your instrument. In all the years that I've been a vocal coach, what baffles me is that most people work with an instrument they don't understand. Too many voice talents don't know how their instrument works or don't know about basic vocal anatomy. When it comes down to proper voice care, too many rely on videos found on YouTube, which don't even explain the reason why they should do this or that exercise. I believe that proper voice care requires proper knowledge about how our instruments function. It also requires an understanding of why some exercises can be beneficial for your vocal health. This is why we're honored to collaborate with an expert, Karen Esposito, for this video. Karen is currently working as a voiceover artist, actor, voice coach, and voice therapist. Karen is a qualified and experienced speech and language therapist, and she specializes in the assessment and treatment of dysphonia. She has over 20 years of experience as a clinical specialist speech and language therapist and as an expert vocal coach, offering individual assessment, therapy, and coaching sessions, as well as group workshop and presentation. She works in the NHS as part of a specialist teams and busy clinic for patients with voice problem and upper respiratory tract breathing disorders, which involves performing laryngoscopy, diagnosing problems, and explaining the anatomy and function of the larynx. She acts as an expert national advisor to the Royal College of Speech and Language Therapists in voice and upper airway disorder. So we hope you will enjoy this video, and if you did, please share it on your social media.
Hi, my name is Karen Esposito. I'm a speech and language therapist specialising in voice and breathing. I'm also a vocal coach, a voice artist, a singer and an actor. So I understand how important it is to take care of your voice and make the very best of it. Over the next 40 minutes, I'm going to talk about semi-occluded vocal tract, or SOVT, approaches and techniques that are commonly used both in therapy and by vocal performers. It's likely that you've come across the term before, but I want to give you as much information as I can in this session to give you a deeper understanding and answer these questions. What are SOVT techniques? Why do we use them? How do they work? Who are they useful for? How do we do it? We will cover some background on the history and research involved so far, but there will also be some essential practical tips for you to take away. Before we begin, I want to stress that there is no one-size-fits-all vocal exercise. If there was, I'd be out of a job. If you experience voice changes or deterioration lasting more than a couple of weeks, you should seek advice from a doctor who may refer you to an ENT surgeon or laryngologist. There are many potential reasons for voice changes and throat discomfort or pain. Most of them can be fixed, but you must always get them checked out if they persist. Before we move on to SOVT, I'm going to explain a little bit about the vocal tract and how voice is made. This will help you to understand how SOVT works. Although we're here to talk about voice, the primary function of the larynx is to be a protective gatekeeper for the lungs. We use this valving mechanism to build up the pressure when needed, to help anchor ourselves for heavy lifting or for bearing down or pushing up, to expel things from either end of our bodies. Thankfully, we've also adapted this clever piece of kit over the years to become a wonderfully complex vocal instrument. If we're lucky, most of us don't even think about how we create our voices on a day-to-day basis. It just happens. In order to produce voice, we need a power source. Air from our lungs provides the energy. Good vibrations to generate sound waves from the vocal folds. Modification or shaping of the sound, adjusting the structures above the vocal folds to change the quality of the sound and to form specific speech patterns. We have multi-source resonating vibrations. If not, we would sound like this. We're not going to talk too deeply about the lungs and breathing today. That's for another session. Let's look at the larynx in more detail though. The larynx is a cartilaginous, bony, membranous structure of muscular levers and pulleys. It's suspended from the base of the skull and the mandible or lower jaw above, and attached to the sternum and clavicle below. It's very mobile. Try placing your finger on your Adam's apple, or thyroid cartilage, the knobbly bit that sticks out the most in your neck. Keep your head level. It may help to trace back from your chin. It may be higher up than you think. Now swallow. You should feel your larynx travelling upwards and tipping forwards as it moves out of the way of your esophagus when you swallow food, drink, or saliva. As it moves up, the vocal folds, the ventricular folds, and the epiglottis shut off your airway, so things don't go down the wrong way. So, the higher up your larynx travels, the tighter everything becomes inside. Now, try to yawn with your finger still in the same place. This time you should feel the larynx moving downwards. This will have the opposite effect to the swallow, opening up your larynx to let more air in. If you make a sound with your yawn, you'll notice the pitch getting lower. If you gently place a finger and thumb either side, you will feel the thyroid cartilage shield. Behind this are vocal folds. Say the sound shh. You shouldn't feel anything in your neck, as this is a voiceless sound. Then say ee. You should then feel a buzz as your vocal folds turn on. Moving further down, the cricoid cartilage sits just below your thyroid cartilage, which can articulate or rock backwards and forwards over the cricoid. You should feel a gap between the two, but don't feel you have to put your finger there. It can feel quite unpleasant, but there ideally should be a gap. If the gap or visor is closed, it could indicate hyperfunction or tightness in the area. Hyperfunction can lead to a feeling of being pitch-locked or stuck in a narrow band of pitch range, and fatigued with a loss of timbre, quality or colour. Your throat may also feel tight, strained, irritable or painful. Now, let's take a brief look over the strap muscles of the neck. They play an important part in swallowing and voicing and can influence the sound and sensation of your voice. So it's good to be aware of how this area is functioning and feeling. Sternohyoid and omohyoid bring the larynx down. The thyrohyoid elevates it or brings it up. You can see the muscles of the tongue, which goes all the way from the tip down to where your chin meets your neck. The mandible and the skull base attachment, these muscles can help move the larynx up, forwards, or back. They are important in helping control the length and the shape of the vocal tract, forming internal, variable, and flexible resonant chambers. They play a minor role in the pitch, but a major role in formants and resonance. Together, the position of the larynx, tongue, soft palate, and pharyngeal constrictors help tune the layers of frequencies or formants to enhance the sound signal produced by vibrating vocal folds. This is what we mean by resonance. Your larynx and therefore your resonant colour palette is unique to you. Most of the intrinsic muscles of the larynx are concerned with closing the gap. But during breathing, the posterior cricoarytenoid muscles move the vocal folds apart to an abducted or open position. When starting to attempt to phonate or use our voices, the vocal folds shut along the midline. Air pressure coming up from the lungs builds in the trachea below the glottis, or the level of the vocal folds and the gap between them. This subglottal pressure needs to reach the minimum air pressure needed to overcome resistance and open the cords. This is called the phonation threshold pressure, or PTP. The harder it feels to talk, the more effort it takes. The higher the PTP becomes, and also the risk of hyperfunction. As the PTP is reached, the vocal folds move apart from the lower to the upper margins. Air rushes through the glottis and pressure drops. Puffs of air are released in cycles per second or hertz. This forms the fundamental frequency. Pressure subglottally or below the vocal folds drops as air rushes out. The faster the flow within the tube, the lower the pressure on the sides, so as pressure is released, the vocal fold outer layers are pulled back together to the centre. This is called the Bernoulli effect, and it forms the elastic recoil stage. This is what is called aerodynamic myoelastic theory. Air pressure opens the folds, and elasticity closes them. If the balance of pressure is efficient, vibration, or your voice, will continue. The cover of the vocal folds move in a wave-like way, independently to the muscle. We call this the mucosal wave. This can be affected by pathology, trauma, or the way we are using our voices, and has a direct and sometimes dramatic distortion effect. Changes in the vocalis muscle beneath the wavy cover result in shape changes and affect the speed of the wave and therefore the pitch. The more frequent vibrations per second, the higher the pitch. This happens very quickly, commonly hundreds of times per second, and impossible to see with the naked eye. We have to use stroboscopy or flashing light to sample video in order to make out individual waves. The smaller the larynx, the smaller the vocal folds. The bigger the larynx, the bigger the vocal folds, in general. Vocal tracts vary in size. Shorter, thinner strings lead to higher pitches, and vice versa. So, the larger the instrument, the lower the pitch, usually. Respiratory muscles are used to maintain constant supported airflow and subglottal pressure. In most languages, not all, there are some exceptions, speech sounds are made on this out-breath or expiratory flow. As I've said, we are not focusing on breath too much this time, but without breath, there is no voice, so there are some basics to think about for now. Think of yourself as a balloon. As you take air in, you inflate through 360 degrees like a balloon. As you breathe in, your ribcage moves up and out, your back and your abdomen expand, contracting the diaphragm downwards. Your lungs expand and fill with air. As you breathe out, your lungs start to deflate with elastic recoil. The diaphragm relaxes into its dome shape as the cavity empties. Your ribcage moves in and down, and the abdominal muscles contract inwards. Keep your shoulders relaxed and focus the movement and effort on your lower abdomen. You can put your hands there to monitor the breath in and out, in and out. This is not breathing from the diaphragm. The abdominal muscles are responsible for moving the diaphragm, and the other respiratory accessory muscles join in to control the action. As the abdominal muscles contract, they exert pressure upwards, causing the contents of the lower abdomen to push up towards the diaphragm and help support the flow of air outwards from the lungs. What can go wrong? There can be mechanical issues, such as after surgery or after trauma or injury. Lifestyle can affect your voice due to smoking, diet, sleep, and everyday vocal use. Drugs can affect your voice. Medication can have all sorts of side effects that can affect the voice by causing dryness, nausea, irritation, reflux, or even neurological symptoms. Hormones can have a significant effect on your voice. Mucus issues, increased risk of hemorrhage, changes in bulk, or swelling of the vocal fold can make a difference. Aging, atrophy or wasting of the muscles, loss of elasticity, and reduced breath support can happen. Systemic disease. It's not uncommon for us to notice neurological diseases first in our clinics. Initial signs for some conditions can happen first in the voice. The same with gastro or respiratory conditions. Pathological issues can make a difference, such as cancer, polyps, or papilloma. Psychological and mental health-related issues can make a difference. Hyperfunction or muscle tension dysphonia leads to unhelpful constriction, increased muscle tone in the larynx, neck, and surrounding areas. Some highly trained vocal performers in vocal effects for singing, extreme and creature voicing are able to use constriction of the structures of the larynx and pharynx to achieve certain sounds safely, but for most of us, we are aiming to open out the throat and achieve forward-focused resonance. What might you be feeling? Pain? Fatigue? A reduction in endurance? This is particularly concerning for the long-distance vocal athlete, such as audiobook narrators, singers, actors, teachers, call centre workers and parents of young children. The list goes on. Volume control issues. It may be harder to speak quietly. Don't be tempted to whisper. This encourages unhelpful constriction of the supraglottal muscles, and you are actually practicing making your larynx tighter. It may also be harder to speak louder, and you find yourself pushing harder in the upper body, neck and larynx to try to get your voice to work as you want it to. If the vocal folds are struggling, your body tries to come to the rescue with other muscles. I so often see patients and clients with an extended head, turtle thrust, and shoulders close to their ears, with effort of compensating for voice issues. All of this will, unfortunately, only make things worse. You may find it difficult to get high, low, or mid-range pitches depending on the issue. If you are a singer, your voice breaks or the passaggio may be tricky. You may experience glitches between your chest and your head voice, for example. Your voice may start to sound breathy, strained, or less melodic. You may start to feel a little unsteady or out of control with your voice and may notice wobbles or tremors. Dryness is something that you can start to address yourself. If you are not keeping well hydrated already, start now. Your body as a whole needs hydration to function, so sip fluids frequently through the day. It takes time for fluid to work through the system, so downing a pint of water 5 minutes before a performance, for example, will not systemically help. You can also start some regular steam inhalation or use a nebulizer device to soothe the larynx directly. We won't cover vocal care thoroughly in this video, but keeping well hydrated is a biggie. So build it into your everyday routine if you care about your voice. Shortness of breath and difficulty coordinating breath support. Experiencing difficulties with your voice can be very worrying, frustrating and sometimes isolating. So it's really important to look after it. Remember, this video is not intended as a therapy tool. If you have a persistent change in your voice or dysphonia for longer than a couple of weeks, you need to seek specialist medical advice. They may then refer you to a speech and language therapist or speech and language pathologist. It's the same thing, once you've been assessed by a specialist ENT surgeon or laryngologist. SOVT. SOVT, or semi-occluded vocal tract techniques, work by causing a partial occlusion or narrowing of the vocal tract during phonation, which causes a build-up of back pressure along the system. This pressure results in a cushion of air between the vocal folds, which reduces the impact and also lowers the phonation threshold pressure, or pressure from below, to open the vocal folds and start them moving. The vocal folds are encouraged into a neutral or Goldilocks position during adduction or closure. Not too pressed or squeezed, not too loose, just right. This results in a more consistent and efficient wave or vibration and easier and safer ways to phonate. The vocal tract is lengthened and a more open larynx and pharynx is achieved. When SOVT exercises are done right, you should feel nothing really in the laryngeal area. The sensation should be in the lips, the nose, behind the nose, or in the face area. They're used as therapy techniques in rehabilitation, but are also used as vocal optimization and protection exercises for warm-up, cool down, and reset. Types of SOVT. SOVT is not just straw phonation. It refers to a family of exercises or techniques, depending on where the narrowing along the track is happening. For example, with humming, it would be at the lips. With a velar nasal, it would be at the level of the soft palate. The airflow with some SOVT techniques remains constant. Or it can be oscillating. The list of SOVT includes trills, humming or other nasal sounds, voiced fricatives, Straw phonation in the air or in water. Use of a mask. This can be made with a specific device or simply with the hands. One of my favourites is the kazoo. I've also seen work with balloons, so the list is not restricted and will probably continue to grow as we experiment and get more creative with the principles of SOVT. The various techniques also have different occlusive effects. Speech is the least occlusive, then nasals, then trills, voiced fricatives, then down to the smallest straws. The greater the occlusion, the greater the resistance and back pressure. With humming and nasals, the occlusion is happening at the lips, the alveolar ridge, or just behind the teeth, or the velum or soft palate. Just like the N sound in the word ring. During nasal sounds, the soft palate lowers to let air through the nose. In oral sounds, the soft palate is raised. Try holding your nose. Tap into your natural hum state by using a humph or a yes hum. This is a great way to find a good pitch to start. Focus the resonance forwards. Feel the vibrations in your nose, your face, or your lips, not in your throat. Keep your shoulders lowered, chin at 90 degrees, and remember the balloon analogy with your breathing. As you breathe out, feel your lower abdomen contract inwards, and then just let it relax outwards again on breathing in. You don't need a deep breath every time. This can lead to excess effort or pressure, and possibly hyperventilation. Don't force or push. Start with single pitches. Then onto glides. And then you could add some vowels. Moo. Me. Ma. And so on. You can continue to practice words, phrases and onwards, but for most warm-up, cool-down and reset purposes, you can stick with the basics up to hum plus vowels. Trills and fricatives. Try single pitches and glides with lip trills or tongue trills. The lips need to have enough tone to start the noise, but not too much to stop the sound, very much like PTP at glottal level. Some of you might not be able to get a trill going, but don't worry. There are ways to work on it if you really want to, so you can get some help with that if you're determined, or just pick another SOVT that works for you. You could try some voiced fricatives. A fricative is a consonant speech sound made by directing airflow through a narrowed opening between structures, causing friction and therefore a turbulent airflow. Some examples are a labiodental fricative made by the bottom lip, labial, and top teeth coming together. An alveolar fricative made with the tip or the blade of the tongue against the alveolar ridge just behind the teeth. These are both voiced fricatives as they're made with a voice. They have partners without voice, which are the voiceless labiodental fricative and the voiceless alveolar fricative. Although the voiceless alternatives have the back pressure opening effect upon the vocal tract, we're not focusing on voice use there, so save those for general vocal tract relaxation work. With your chosen voiced fricative, Keep your shoulders lowered, chin at 90 degrees. Remember the balloon analogy with your breathing. As you breathe out, feel your lower abdomen contract inwards, and then just let it relax outwards again on breathing in. You don't need a big breath every time. This can lead to excess effort or pressure, and possibly hyperventilation. Start with single pitches. Then onto glides. Then add some vowels. The trick with all of these exercises is to direct effort away from the larynx. It's quite difficult to squeeze in the larynx at the same time when using SOVT exercises, but it's not impossible, so just be aware. Straw phonation as an SOVT was described by Titze in 2006 as an SOVT introduces some sort of narrowing. This narrowing can occur at any supraglottic point along the vocal tract, so anywhere above the vocal folds. Semi-occlusion can be formed by the articulators, for example the tongue or the lips, or by an assistive device, such as a straw inserted between the lips or a kazoo. We first hear of straw phonation over 100 years ago. Sovijarvi experimented voicing with different tube lengths for children and adults, and this method has been known by some as the Finnish tube since then. So, straw phonation was commonly used in Finland before spreading to the rest of the world. In 1991, Marketa Sivo, a Finnish speech and language therapist, introduced her prescriptive method of approaching straw phonation with lax-vox technique. This uses straw phonation in water and abdominal breathing support with specific, systematic progression of exercises. The silicone tube used is a specific diameter and length, and the company has also developed special equipment for lax-vox technique, including valving and an optional mask. In 2006, Ingo Titze helped spread the word about straw phonation with his paper, Voice Training and Therapy with a Semi-Occluded Vocal Tract, Rationale and Scientific Underpinnings. In it, he uses a computer simulation with a self-oscillating vocal fold model and a 44-section vocal tract. This was used to replicate interactions within the vocal tract with semi-occluded emulations. A semi-occlusion in the front of the vocal tract, at the lips, raises pressures above and in between the vocal folds. This makes the voice more efficient. As well as increasing vocal efficiency of phonation, lower vocal fold impact stress was noted by Meersman et al. In 2021 with straw phonation in water, which suggests that using the technique in vocal training and rehabilitation can reduce the risk of phonotrauma. Meersman et al. Also concluded that a secondary vibratory source at the distal part of the vocal tract, or straw phonation in water, produces fluctuating back pressure that possibly creates a massage-like effect on the vocal folds and the vocal tract, leading to relaxation, improved blood circulation, and more comfort. 3 years later, in 2024, Meersman and colleagues found that straw phonation in air leads to a more roomy, open larynx due to less false vocal fold adduction and consequently less hyperfunction. The results of Manyanatha et al. Study in 2021 showed a significant improvement in the fundamental frequency and the formants 1, 2 and 4 intensity. Maximum phonation duration, so how long voicing can continue, and self-perpetual measures, or how the participants felt, supporting the use of straw phonation as an effective warm-up. Results from studies did not all agree, and Kissel et al. In 2023 didn't find any significant objective results to show effectiveness in the use of SOVT. But reports from the participants were really positive. Users of the technique described significant improvements in vocal comfort, vocal effort, and vocal quality in both groups, so they felt great, even though the other more objective measures said otherwise. They were using SOVT with ventilation masks in their study. In my practice, my patients and voice coaching clients regularly tell me that their voices feel easier, more comfortable, and more efficient, with a sense of increased space and improved resonance immediately after using SOVT techniques. We're all human, and human beings are more likely to repeat something that they find pleasant, especially if we feel that it's doing us some good. Now, what is more important, diameter or length? Smith et al. In 2017 found that diameter is the critical variable for governing flow resistance. The mouth pressure behind the lips will vary slightly with different mouth shapes, but this effect was considered relatively insignificant. Titze advises that the more tight or pressed the voice, we should aim for a thinner straw, 3 to 4 millimeters. This was supported by the Maxfield group in 2015, who found that straw exercises in air using diameters larger than 3.5 millimeters might not produce sufficient pressure in the mouth for efficient and effective voice therapy. Guzman et al. In 2013 and Andrade et al. In 2015 both found most changes were found in the tube of 3 millimeters. High pressures push the larynx lower and relax the walls of the pharynx. With a narrow straw, soft palate movement for closure improved during and after exercises. These are all reasons why resonance improves after the exercises. Changes to straw diameter affects the back pressure more than relative change in length. When tubes were submerged in water, only a small increase in resistance was observed as the flow was increased. Wider tubes in water produced an almost constant back pressure, determined by the water depth. So you need to put the straw further in or further out of the water to change pressure with wide straws in water. Lower down in the water, the density of the water increases, so the back pressure will increase too. Thinner straws in air produce relatively large changes to back pressure with airflow. So with thin straws, the harder you blow, the greater the back pressure. It's diameter that matters and not the length. However, in their study, Mishman et al. Used a regular drinking straw, 5 mm diameter, 21 cm length, for all straw phonation tasks, and found decreased vocal fold impact stress, and also that during straw phonation in air, with a drinking straw, vibration amplitude and mucosal wave increased, which might possibly indicate less false vocal fold adduction, and therefore less hyperfunction, both during the execution and afterwards. Titze in 2024 conducted a pilot study computer simulation looking at multiple source vocalization in the larynx. His findings suggest that the true folds, false folds, and aryepiglottic folds may interact as sound sources. This is an interesting finding. Traditionally, we have focused so much on getting the false folds out of the way during voicing, but the reality of safe and efficient voice production is much more involved, and we have much more to learn about the complexity of the human voice. So, all in all, the evidence appears to support SOVT. However, again, the picture is not as straightforward as it seems. Pozzali in 2021 conducted a systematic review of the literature and found that voice therapy based on SOVTs is not to be considered significantly superior compared to other treatments, and more research is needed. That said, on a day-to-day basis, there are many people using SOVT exercises who will swear by their benefits, so let's stick with it. So, straw phonation, how's it done? Get yourself a container, a cup or a water bottle will do. Pour in at least 6 centimetres of water. Choose your straw. Remember, the narrower the straw, the more resistance. Relax extrinsic laryngeal muscles, that's the neck, the shoulders and the jaw. Hold the straw to prevent clamping and tightening of the jaw. Lower your shoulders. Get a good seal around the straw with your lips. Don't overbreathe or push. You don't need a massive deep breath for this. You also don't need to blow until you drop. Just relax. Do it first without voice, just to get used to the feeling. And now with voice. Try a few different pitches. Remember, you can support with your abdominal muscles again. Try stopping and starting the noise. Support from below and move the resonance forwards and the effort away from the throat and lower it to the level of the abdominal muscles, not the diaphragm. Make use of the feedback the exercise is giving you. Where can you feel any sensation? Notice the bubbles. Keep them at a consistent speed and don't let them plop. Vary pitch levels. Low to mid to high on a single pitch. Stop and start gently as we've done. Try the pitch glides. Then when you're really confident, try a song. Gradually, when you're ready, start to move the straw up through the water. Try it again on the surface. And then gradually bring the straw out of the water. Take the straw out of the water and repeat all of this out of the water. Here's the straw. Put your hand in front to make sure you can feel the airflow. Try increasing the airflow, so blowing a bit harder, and then try different diameters to see how it feels, and maybe aim for the 3mm straw if you can. It's no problem at all if you just don't feel comfortable using the 3mm. This is not an exact science, and we're all made differently anatomically and functionally. Practice little and often every day for vocal maintenance, and or use as part of your warm-up and cool-down and reset routines. Several times a day for 5 minutes at the most at once. You might notice that the effects are at their best just after practice, and that after speaking for longer, placement of your voice may move to the throat. That's why repetition matters. But we should be aiming to carry over SOVT technique effects into our everyday vocal patterns. You might find that you're able to do this on your own with practice, or consider working with a speech and language therapist or vocal coach for guided specialist help. SOVT exercises are great, but please do note, results are usually temporary, unless repeated in a meaningful fashion and incorporated into a systematic progression. Just keep practicing. If you have problems with your voice that do not resolve within a couple of weeks, you need to seek the advice of a doctor. And maybe following this, a laryngologist or ENT consultant specialising in voice. Doctors Google and YouTube are not alternatives. Straws will not save your vocal life. They are not a magic tool. There are many vocal trends, but all will not fit your voice. There is no single exercise that will suddenly change your vocal habits and improve vocal function and speech quickly. If you are a vocal performer with specific skills such as extreme or creature voice work, SOVT exercises may not be appropriate for a warm-up. However, they may help with cool-down after voice work and help to optimise efficient and safe speaking voice in between performances. This is not, despite what you may hear, an exact science. No study has as yet addressed fully the complex individuality in anatomy and function of the human respiratory system. We must remember that voice is a secondary function. The primary function of the vocal folds is to protect the lungs and preserve our lives, and our desire to utilise the secondary function of voice invites complication and multiple variables. My opinions are based on 30 years of clinical experience and consideration of the persistent and systematic work of clinicians in the field of voice, as well as the evidence to date. This is not a scientific review, but an introduction to SOVT, and there are many views on this approach. This is mine. I remain open to communication and conversation about the subject and how it may progress and be applied in a practical and repeatable manner. In conclusion, there is a lot of content out there about SOVT. SOVT does not equal only straws. You do not have to spend a lot of money on equipment to achieve effective results. The work and the evidence so far is limited, but does suggest that overall, the group of exercises involved help reduce pressure needed to start the voice, balance pressure along the vocal tract, reduce tension between the vocal folds and risk of trauma, increase self-awareness of the sensation of placement of the voice and resonance, give biofeedback with sensation and visually if you are using bubbles, work through any glitchy vocal break or passaggio difficulties smoothly, sneakily improve respiration, phonation coordination and airflow, improve sound and control, encourage more melodic speech, more efficient use of prosody, move away from the beige and get more colour back into your voice. Useful in therapy with vocal lesions, gentle enough for use post-surgery, for hyperfunctional voice disorders and for patients who struggle with other forms of therapy where feedback needs to be more obvious. SOVT can be very useful though in warm-ups, cool-downs and vocal optimization for professional voice users, the management of vocal fatigue, prevention of vocal strain and improved self-monitoring in non-pathological voices. All in all, they can be a very effective therapy tool with supervision and instruction from a trained clinical professional, and are also great for warming up and resetting an essentially healthy voice. As an extra bonus, you can use the principles of SOVT without voice to relax and open up your vocal tract when you need to calm down and slow down. Take a sniff up your nose to open up the larynx, then blow out through pursed lips, lowering your shoulders at the same time. Use this when performing to centre yourself or just for an everyday check-in. Now relax and go and enjoy some SOVT.